Good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for Wednesday, July 9th, 2025. My name is Julia Gruss. I am a research project coordinator at KU's Center for Public Partnerships and Research. And I will be joined today as well by my colleague, Brianna Houston, who will be dropping any relevant links that you see on your screen into the chat for you. We are going to get started. As always, a reminder that our webinars are held on the second Wednesday of the month. If you'd like to stay up to date with early childhood updates, you can sign up to receive the All In for Kansas Kids e-newsletter on the Children's Cabinet website at www.kschildrenscabinet.gov. And today, we have Derek Flerlog and Jarvis Dolman of the Kansas Department of Health and Environment's Child Care Systems Improvement Team here to present today on the role that the Child Care Systems Improvement Team has played in advising child care policy and procedures. They will also discuss the recent Child Care Roundtables that were held across the state and the role that the Child Care Systems Improvement Team can play moving forward. After their presentation, we'll have a few early childhood systems updates for you, and then we will send you on your way. But without any further information from me, I'm going to pass it off to Derek and Jarvis.
All right, thanks, Julia. Well, hi, everybody. Thanks for having me. I know everybody loves when we serenade them over the lunch hour. We're told that we have up to 45 minutes. I can almost guarantee we likely won't be talking that long. So hopefully we'll give you some time back to enjoy your lunch hour a little bit more than just listening to us. Jarvis and I are here today to talk a little bit about the Child Care Systems Improvement Team, what that is, how it factors into child care licensing at KDHE, child care policy across the state. I do want to mention and give a lot of credit to Melissa Schoenberger, who is now with the Kansas Children's Cabinet. But she's really done a lot of work with our systems improvement team over the many years that predate Jarvis and I. So a little bit of a disclaimer just to say that Jarvis and I, relatively new to systems improvement team, and we've done our best to compile information. I think as far as the vision moving forward for SIT, what I would call it SIT team, for SIT, how it's functioned the previous couple of years, and then moving forward, certainly over the next year, in respect to the Office of Early Childhood, that we do have very good information on that. So we'll go ahead and go to next slide, which I know is just introductions. There I am. Hi, Derek Flerlog, Bureau Director for Family Health. I'm also the Bureau Director for the Bureau of Disease Control and Prevention at KDHE. If you ever see my name associated with that, it is not an error. You can see my email and phone number on the screen should you ever need it. And then Jarvis, I'll let you introduce yourself as well.
Good afternoon, everybody. Jarvis Dolman. I'm Director of Operations for Child Care Licensing with KDHE. Thanks for having us on and joining us for this conversation. You can go to the next slide. So Derek and I always try to give a little bit of an overview of where we are, where the Child Care Licensing team is at KDHE. There's a lot of different programs and divisions and bureaus, but specifically ours, we are operating in the Division of Public Health within KDHE. Within the Division of Public Health, there is the Bureau of Family Health. And then within that Bureau of Family Health, there are several programs. Derek just mentioned a few that he oversees, but Child Care Licensing is one of those within the Bureau of Family Health. So as far as child care licensing, we realized over the last couple of years that how big this program was. And so what we've done is we've broken the program down in two different sections, still operating under one, but focuses on two different sections. So like I said, I am the Director of Operations for child care licensing. So overseeing our applications, our compliance and monitoring, background check team, contracts, budget, IT, all that kind of fun operational stuff. And then we have our co-director, Jennifer Manuel, who's not on, but she is the Director of Systems and Field Services. So she oversees our team that is out in the field doing our inspections and surveys and ensuring that team is on track with what they're doing. So As far as child care licensing, we are here to carry out the health and safety portion of the Early Childhood State Plan. And that plan is led by our partners at DCF, who oversee the Child Care Development Fund that we get from the federal government. So you can go to the next slide. So a little bit of history about our program. In 1919, a law was passed requiring licensure for programs in Kansas. And as far as I know, we are one of the oldest programs in our agency and one of the only ones that are actually in law. So that's something kind of cool about us. We're required by law to be in operation. So we establish and enforce the safeguards for child care facilities across the state. So just ensuring the preventable, or to reduce the risk of preventable harm to children and out-of-home care. And we also like to mention and make sure everyone understands that our regulations are kind of foundational. It's just a standard level of care. We don't handle quality. So, when we're talking about licensing, we are that base foundational level for being licensed. As you can see kind of below, those are kind of some high level areas that we're responsible for. So like I mentioned, applications, background checks, surveys, and doing inspections. And then we also have a unique model different than a lot of other states where we have a model where we contract with some local health departments across the state to do some of our surveying. The reason behind that is we like to have individuals that live in those communities, work in those communities. We found that there's some correlation between relationship building that's a pro of having those individuals survey in those counties. So, and then also we ensure that our providers get technical assistance, also that our licensing specialists are getting technical assistance on an ongoing basis as well. And we can go to the next slide.
All right. Thanks, Jarvis. Yeah, I love this slide. So this is kind of a snapshot of what we've referred to as our Kansas Child Care Support System. So it's not an all-encompassing graphic. There are plenty of other partners that we don't have listed here. We could only fit so many on the screen. But we're really painting the picture of, what are all the players and partners at the table that really help support the licensed childcare facility, and perhaps even more than that, support the children and families. I know Jarvis and I, and probably so many on this call, have children that attend licensed daycare, whether it's an in-home daycare, a center, a preschool. Jarvis and I's case, it's both. And so we have unique insight as well into working with several of these partners. But there's a reason we've sort of highlighted that children and families circle there in orange, because that's the purpose of all of us. That's the reason we all exist here in the childcare system space. Next slide, please. So what is SIT team? SIT team encompasses essentially all of this. And really what I'm trying to convey here on this slide is that the SIT team works to provide advice and recommendations to the department, but for the purpose of all of the partners that were and are on this screen. And so we'll talk a little bit more here in a few slides about maybe how the vision of SIT has changed over time and even over the past couple of years. But we really want the members of our SIT team to bring concerns or to bring positive highlights, negative highlights, from any and all angles. And so if we are hearing things from the licensing perspective, we certainly want to know about that. But if we're hearing things that have to do with, technical assistance, or if it's about business supports, or if there's questions around fire code and fire approval, we've worked really hard over the last couple of years to create and strengthen those relationships and partnerships at the state level, so that our providers and our children and families and the partners on the screen as well feel the benefits of that. Next slide. All right, so a little bit of history. I will tell you, I went back and pulled some historical documentation, and it was really very interesting. We have a lot of old documentation, as you can imagine, at KDHE, documents that go back decades, maybe centuries at this point, on the systems improvement team, and this is on our webpage. The SIT team itself was initially formed in 2007, and it was done so in partnership with other state agencies for the purpose of advising KDHE and those state agencies on child care improvements and needs. So again, I mentioned just a moment ago, the team does serve in an advisory capacity. So essentially, you can imagine other advisory boards where they are taking input from the public, or they're taking input from their own personal and professional lives, or things that they're hearing, sort of boots on the ground approach, and elevating that information directly to the licensing program itself, or the governmental body that has authority and has the ability to change things or improve things, or do certain things. So our documentation from 2007, very, very interesting document, and really clearly outlined kind of the purpose and some of the guiding principles that has followed the SIT team through the years, in different ways. And I found it interesting how a lot of the information from 2007 still applies today in 2025. It's hard to believe that it's been almost 20 years. But over the last couple of decades, you can see we're still working to update and improve our regulations and make those necessary process improvements in the program. And we'll talk a little bit more about that in a moment. Of course, building a 21st century childcare system, I think that's on the horizon as well. We have the Office of Early Childhood, which is playing into that, and a new licensing system that we're very, very excited about and working on. And then there was obviously some other mention of foster home regulations and things that may no longer live at KDHE at the moment. But for the purpose in 2007, that was the listed purpose. And then guiding principles. So I think kind of helping guide the members of the SIT team to, how should they work through the information? What sort of recommendations should they be making, and how do they go about that? So of course, the top one there, focus on ensuring child safety and well-being. That's really the mission of our program as well. There's always a balance between safety, best practice, business practice, and balancing that with regulatory components as well. We want an understanding of the current system. I know one of our focuses with the SIT team has been education too. It's been for the program, for child care licensing and other partners to open up and say, this is why we do something, or here's a little bit more information on that area of concern. So just trying to have that transparent approach. Being data driven is always huge. I know Jarvis and I are both huge fans of data. And helping that guide your decision making and telling truths around what might be happening in the state regarding childcare. Network of quality providers, of course, always looking to increase accessibility and the capacity of our quality providers to provide care and education. Working to eliminate unnecessary bureaucratic barriers and inefficiencies. This has been a huge role of the SIT team, I would say. And sometimes we don't get recommendations through the formal meetings, but the members themselves are able to elevate issues as they come across them. So it's really about building those relationships, identifying those pain points where we can improve as a state. Jarvis knows all about improving flow of applications and our background checks and fingerprints, and just all the things that him and his team have worked on over the last nearly 3 years now, Jarvis, that you've been here, to make improvements there. So, and then I think creating a process for continuous quality improvement. Again, this identified in 2007, this is an area that we've identified to really improve upon and to really show more follow through in coordination with the SIT team. So they know that, yes, we are hearing their feedback and these are the things that we're doing or not doing to see those things through. Next slide, please. So a few recommendations over the year. Again, I found this one interesting too. There were several recommendations in 2009 that addressed child safety, consumer protection, quality, flexibility, availability of care, and then always striving for regulatory consistency. And then 2010 recommendations, looking more at our inspection processes, which we're always looking to improve and be transparent on. And then the technical assistance that's provided during those as well. And we kind of we want our providers to understand what to expect from those inspections. And so got some great feedback from the SIT team to kind of help realize those and addressing efficiencies in the program. And then I'll mention Lexi's Law, of course, the implementation team that utilized SIT's structure. And that was a huge change in Kansas, a very, very important change in terms of furthering health and safety, the components of health and safety for childcare across Kansas. And I did include a copy of the actual document from June of 2014 there. You can see the listed purpose and those guiding principles direct from that document. Next slide. So moving on to a little bit more recent, there was a pause in SIT for a few years. Luckily, it was reconvened around 2020. The agency and the state as a whole, with the assistance of preschool development grant funds by way of the Children's Cabinet, that helped reconvene this SIT team and what it takes to facilitate a team and a kind of an advisory board in this manner. I will say that based on that documentation and just this, discussions that I've had with folks who were on original groups, reconvened groups, staff members who are no longer here but are retired and did work for KDHE through kind of the changes in this 20-year period, that said there was really a renewed sense of purpose, but still committed to those same guiding principles. So those guiding principles and the purpose of the SIT team itself has really held strong over 2 decades time. We did have SIT review and provided feedback on a potential childcare legislation. I know back in 2023, I believe it was 23, in my first month at KDHE, I attended my first SIT meeting, and they were tasked with reviewing some legislation and really informing on some of the impacts that the agency might not have considered, or that other agencies or legislators might not be considering, and just trying to make sure that we had the best information available on that legislation, which ultimately did not pass. And then to SIT, I think one of the most productive and greatest things I've seen to this point is that our Child Care Matters campaign, SIT was the originator and the recommender of that. The logo there is at your bottom right screen, and the KDHER agency has been able to do a couple of different media campaigns on that, one of which we did February 1st to April 28th of last year, of 2024. And so again, SIT team recommended this, it was approved, we had assets, in other words, graphics and commercials and really things promoting the importance of licensed care and why licensed care matters, aka Child Care Matters. And that resulted in over 7.5 million impressions. We had almost 62,000 clicks. And then in total, the campaign that the agency did, utilizing this approved recommendation from SIT, it resulted in a 13.1 increase or over delivery compared to estimates. And so that was really, really beneficial. I think a great use of that utilized PDG funds as well. And we're certainly looking to continue doing something similar and promoting the idea and really the truth of why licensed care is important and why it matters. Next slide, please. And I believe this one is you, Jarvis.
Oh, I think that's one more for you, Derek, I think.
Oh, okay. I will continue with this one. So as everyone's well aware, we had a licensing regulation review. We've continued that for a couple years now into a couple of different areas, but we had we really kind of kicked off this big regulation overhaul back in 2023. And I just wanted to highlight the importance that the SIT team played in that. I think as most people are well aware, we had a couple of different feedback sessions and engagement sessions directly with childcare providers, as well as with our public health community as well, talking to our local health departments and getting their feedback. We had online surveys, and we did different summary of change documents and just individual meetings as needed with different partners and stakeholder groups. But we also brought this to our systems improvement team and tried to include them into that feedback as well. And so just like all those other partners, this included getting ideas to draft updated regulations or new regulations or revoking regulations that we felt like weren't appropriate or necessary at this time. we utilized them to take that drafted language to have them provide feedback, and then kind of following through it to say, hey, here's what we're rolling with. Here's what's going to the Attorney General's office for review, hopeful approval, and then public comment, and then publication in the Kansas Register to become effective. Those regulations obviously did go into effect in August of, oh gosh, Jarvis, was that 24 or 23? I can't remember now. It's been a few years, but August 2nd. And that was very, very exciting and a huge change as we tried to streamline, some of our license types and provider qualifications. We had to come up into compliance with some federal requirements around health and safety as well. So SIT team there played a huge, huge role in making sure that we had accurate feedback, again, from all angles. We have providers that are on the team. We have folks from more from the education perspective or sphere. We have members of advocacy organizations and advocacy groups, and then other state agency partners as well. So folks that might work for government or work in government, but not necessarily childcare, and are able to still give good feedback as well. Next slide. And Jarvis, if you don't mind, can I take that top bullet? Because I know we were chatting about that one a little bit. I just wanted to mention, just because I touched on it earlier, so I thought I might just sort of continue a little bit. One of the things we started looking at last year around SIT team was, how can we make them even more important, I guess, right? How can we sort of elevate their purpose? And are we asking them to provide feedback on licensing, or could we expand that? Could we look at them as more a systems level advisor? Why limit it to licensing? Why can't we say, hey, what's going on in child care? Not just child care licensing, but what are you feeling in child care around the state? And as we get that feedback, how can we elevate that to all of the partners at play? So like I said, maybe KDHE doesn't necessarily oversee or do a component of what we're getting feedback on, but how can we be a good partner? How can we promote good government to say, oh, we'll take that feedback to insert partner here that does that, so that they're aware of this feedback, and we can help facilitate change if it's needed, or if we get feedback from them and they are able to not just educate the folks that might have brought that up, but educate us as well, so that we can help be better partners. All right, Jarvis, sorry about that.
No, that's a good lead in, because me and Derek started roughly the same period of time, and something we were really wanting to do was try to get out in the community. I think a lot of state workers get the reputation for just being in the office and not coming out and being present and being seen and making connections. So that's something when we first started that we wanted to change. And so what we did is we set out just on our own to kind of get out to go, and we went to our local health departments across the state just to introduce ourselves, kind of give them overview of ourselves, what we do, what licensing is, and just trying to make connections.
Go potty.
And what we found, when we were in conversations and introducing ourselves is a lot of the health departments had questions that always weren't licensing related. We did have some licensing questions, but there was things that, that were out of scope of what we do. But another thing we had been trying to do is make connections with state agencies, like Derek said earlier. And so as we made those interactions with the health departments, we gathered all the feedback from all the different areas, and we took them back and we would share those with our partners. And so something we wanted to try in a new realm of the SIT team was having these regional roundtables that just wrapped up last month, actually. We're going to try to do another one here in the Johnson County area sometime soon. But the purpose of those was to go around and really get the feedback from across the state, from the different counties and the different regions, because as we know, the issues and concerns that that happen around the state are always different in the different areas of the state. So we decided to have these regional roundtables to make up for our regularly scheduled SIT meetings. And so what we did is we went out and we asked the counties in those areas, what's working well in your areas, what's not working well, and what can licensing do specifically to help out with childcare in your area. And so we got a wide range of responses. And so what we've done is collected all that feedback, and we actually have a meeting tomorrow to kind of sit down and look at what all those responses were. And the plan from there is to take those responses and try to act on that feedback, whether that's within our own program, whether that's with another agency that we've made great relationships with, and try to create some kind of change and helps in those different communities. Like Derek said, we're looking at trying to make a more holistic approach and take a different perspective, and not just making it licensing only. Of course, licensing is what we oversee, but that doesn't mean we can't take that information and go share with partners. And like I said, I think really getting out in the community, showing our faces, showing that that we're there and we want change, I think that's going to make a big difference in us being able to gather that information and share with partners. Next slide.
Yeah, and I would mention too, Jarvis, it's Child Care Systems Improvement Team. It's not Child Care Licensing Improvement Team or Child Care Licensing. So I felt strongly about that to really have a systems improvement team, um, and at that point when we were evaluating this sort of change in scope a little bit, it's not that they couldn't bring that feedback, but we wanted that to be built into the purpose, to be quite honest. Um, at that point we were acting what we would call in the spirit of the Office of Early Childhood, because it was not a passed piece of legislation at that point. We really decided we need to start acting, better as partners and as one system. On the state side of things, of course, we operate as different agencies, and we've got different folks and team members and staff members involved, and we work on those relationships and in lines of communication. But our children, our families, our partners, they should not feel that separation. They should feel kind of a unified front. And so we felt the same for our systems improvement team. All right, next slide for Jarvis.
So yeah, the vision for so Derek just mentioned Office of Early Childhood. Pending those changes, we don't know what that's going to look like. Our hopes is this, that the systems improvement team will still be there. We'll still have a presence in the governance structure. But yeah, pending those changes, we want to see this through. We want to see the systems improvement team through. Also, trying to provide that transparency and making sure that, when we do get recommendations and feedback, that it's followed through. And that's one of the reasons we want to get out in the community and show our faces. I think that helps with transparency when people can put a face to a name and make those connections. Not only does that help the providers and the community know that we're on board, but also for us, that gives us holds us accountable to making sure we make those connections, that we're going to go back and really do something about the feedback we're getting. And just kind of mention more involvement in person interaction. That is something that, that we want to continue. And we want to continue to go out and have these in-person interactions. We want to make connections. And I think that's something that's really going to change our program, the way our program's seen as a whole. And hopefully creating those connections will bring about more true feedback and really get people saying what needs to change and what they'd like to see. As we've mentioned all through this, I mean, this is systems improvement team is a really important advocacy group for the governance structure. And wanting to make sure we move through the system and make sure we're modern in everything we do, kind of like some of the things Derek's mentioned, whether that's our new system, whether it's our regulations, always looking at how can we move forward. I think sometimes state agencies and state work in general gets the rap for kind of just doing old processes. And I think that's something I know for me and Derek, we're always looking at what's new. Not a lot of people like change, but I think, to keep up with the way time's going, we have to change. We have to continue to adapt, look at our regulations, look at how operations, how things are working and efficiencies. And that's something the systems improvement team has helped with, as you can see, and will continue to do so.
Yeah, one of the things with SIT is we really want to be more transparent in the feedback that we get by documenting that, and then documenting the follow through on that feedback that we receive. So, I've been on advisory boards and other things of that nature where you mention something and whoever you're communicating it to, whatever the purpose of the advisory board is, they'll say, "Oh, okay, thanks for that," and then nothing might come of it, right? You're like, what do they do with that? And we don't want the SIT team to function in that manner. And so there's been a lot of discussions about how do we take that feedback, formally document it, and then show the follow through. prove the follow through on that, whether we can or can't do something. And if we can't do something, why? So again, it's that education component, and then utilizing SIT team to provide that information back to the public as well. So they sort of become experts in their own right on the child care system ecosystem across Kansas. I do want to give a huge shout out to our friends at KUCPPR for helping us facilitate the SIT team. I will say membership for SIT runs through the summer of 2026. And so again, pending changes with the Office of Early Childhood, I will certainly promote the importance of the SIT team. Um, uh, and so again, the membership of that though goes through summer of 2026, and then there are opportunities to apply and kind of go through that process for the systems improvement team um, membership itself. So yeah, just huge shout out to our KUCPPR colleagues for helping us facilitate and document the feedback that we get, especially at these regional roundtables that have been very well attended. And we've been working through a lot of these process changes. We can go ahead and go to the next slide, which I believe is we're done and questions. So Julie, I'll kind of look at you. We are open for questions if there are any.
Yes,
Otherwise,
thank you
thanks
both
for
so
having us.
much for presenting. Absolutely. Thank you for being here. And anyone with questions, you can feel free to come off mute and ask or drop them in the chat. Yeah, we will
If
give
there are
that.
members of the SIT team, Julia, can I ask them to come off mute
Yeah,
and share something that you enjoy about it, or if you've previously been a member? I mean, we'd love to hear it.
absolutely. If anyone's feeling brave.
And everyone saw our emails on the first slide, so you can always provide that feedback at a later time too.
One of the things I have to say I've enjoyed is the transparency, and I have felt very heard that when something I voiced, I feel like it was respected and paid attention to, and that I got an answer. So I've enjoyed very much sitting on this team and enjoyed very much everyone, KDHE, and all the individuals that have worked on the team very much.
Thank you, and I appreciate that.
I can say that I did some facilitation help with the SIT team when I first joined CPPR, and the collaboration between KDHE and the members of the SIT team was always amazing to see. And like Anel just said, that the members of the team are really listened to and taken seriously. And I think it's just a great group to have for the state. From the chat, we have Bernie Howbeard saying that some background news. She has some background noise, so she doesn't want to unmute herself. But the SIT team is an important connection between the regulation and practice. In the regulation review specifically, it provided an opportunity to explore creative solutions. Thank
Yeah,
you for that, Bernie.
that's right, Julie. I would say too on that, Bernie. Like when you have a group of folks, sometimes it's easier in a smaller setting to get that feedback directly than a meeting where you have 500 or 600 plus attendees or a couple thousand attendees. But when you have a group like this where there are providers on there, or there are licensing specialists, or folks from other state agencies or advocacy organizations, you're able to kind of, I don't say quickly, but efficiently work through some of the regulatory successes or concerns, issues as they arise. So I definitely saw that firsthand. That was very apparent. Like I said, that very first SIT meeting I ever attended, had no clue what I was doing, and just watching through, they had work groups and things like that, and so it was very cool to see it in action in my first 30 days.
And my apologies if I'm repeating information, but those child care system improvement team meetings are live streamed on the Children's Cabinet YouTube channel, and then they remain there as recordings, so they can be watched at any point.
Yeah, and we haven't been able to live stream the regional roundtables, obviously, due to just it's very hard to do. We've tried to do those in at actual licensed facilities, and I mean, you all can imagine the logistics of getting that set up are very difficult. Um, but I would also mention to Julia, it became more apparent to us after we were putting this presentation together, but our webpage does need updated. It does have older documentation, which is still accurate, but we do need to update our systems improvement team webpage, and we'll get that done. I'm not going to put a deadline on that though. We have a lot of other things going on.
Absolutely. Well, I just want to say thank you one more time to Derek and Jarvis for being here and discussing the child care systems improvement team with us. And thank you for everyone's feedback. I am going to move on to our early childhood systems updates. So again, thank you, Derek and Jarvis. We appreciate your time. All right, we have just a few updates for you today, starting off with our Kansas Maternal and Child Health Seeking Family Leaders. Join the Kansas Department of Health and Environment to support and shape priorities across the state. KDHE is recruiting family leaders across Kansas, including parents, caregivers, or individuals who have lived experience with a child who has special healthcare needs or disabilities, or who are passionate about supporting these children and families. As we know, family voices are essential in creating systems that truly work for our children and families in the state. So you can please share this opportunity with any family members or caregivers in your network that might be interested, and you can apply utilizing the link that was just put in the chat. So family leaders will work alongside the Title V Family Systems Consultant and the Help Me Grow Kansas team. They will help shape our family leadership training, which is modeled after Iowa's Family Leadership Training Institute. They will support community outreach events like books, blocks, and balls, and they can share their voices and experiences to guide programs and services. Next, we have a funding opportunity with the Child Care Zones. So this is the second round of funding, and it's back for a limited time. The applications for the second round of funding are due on August 25th. You can find more info with the link in the chat on the Child Care Zones, what they are, and what this funding looks like. KDHE will also be hosting an informational webinar about this funding opportunity from 11 a.m. to noon on July 17th. You can register to attend as well from the link that Bree has just placed into the chat. And prospective applicants must submit an application interest form before starting their actual application for the funding. So that as well will be placed into the chat. And if you have any questions, you can contact Jennifer Burgart at jennifer.burgart@ks.gov. And an additional funding opportunity, the Preschool Development Grant Family Compensation Funding. There is limited funding still available for year one of the Preschool Development Grant. So funding is for early childhood programs that are seeking to compensate families for participating in family engagement opportunities that support the expansion of the All In for Kansas Kids Early Childhood Strategic Plan. Programs that are seeking funding can submit a request utilizing the link in the chat, or you can also email me, as I am in charge of this initiative, at jgruss@ku.edu. Keep in mind that this funding is through the first year of the preschool development grant, which means that all allocated funds will need to be spent by September 30th. So this is if you have an event coming up very quickly. If you have a family engagement opportunity that might be taking place later in the year or early next year, you can apply for year 2 funding at a later date. So this is for any funds that would be sent out and spent before September 30th. So again, there's that request form that you can fill out, or you can email me directly at jgruss@ku.edu. Lastly, just our reminders and next steps. Our next early childhood recommendations panel meeting will be held on Friday, July 18th from 9 to 11:30 a.m. The next Children's Cabinet meeting will be held on Friday, August 1st from 9 to noon. And our next Early Childhood Systems Building webinar will be Wednesday, August 13th from noon to 1. And as always, you can find all of these meetings recordings on the Children's Cabinet YouTube channel. So stay up to date with us by signing up for that All In for Kansas Kids e-newsletter, or by subscribing to the Kansas Children's Cabinet YouTube channel. We appreciate everyone for joining us today, and we will give you some time back in your lunch break. So we hope you have a very wonderful Wednesday and enjoy the rest of your week. Thanks so much for joining us.